Hello, this is Dr. Brett Taylor. I'm an orthopedic spinal surgeon, and in this case, I'm describing the treatment of a 59-year-old gentleman who was injured on the job. He had a previous injury approximately 20 years ago. However, based on a recent injury at work, I determined that based on a reasonable degree of medical certainty, his more recent work exposure caused a permanent aggravation to his pre-existing lumbar disease. This gentleman had had numerous prior surgeries, 4 to be exact. We determined after examining him that he had chronic radiculopathy and failed back syndrome. He was having increasing difficulty standing with symptoms in both legs. He also had weakness and decreased sensation in both legs, and his reflexes were diminished bilaterally. We determined during his workup that the prior surgery at L5S1 was solidly fused. However, he had symptomatic adjacent segment disease at both levels proximal to the prior surgery. This was further elucidated with dynamic X-rays which revealed instability at L45, and diagnostic injections confirmed facet and nerve root irritation at L34. In addition to the dynamic imaging, in my practice, additional imaging tests are obtained. In this case, a myelogram was obtained with a CT scan, which confirmed the lower fusion at L5S1 was solidly fused, and there was clear problems above the old fusion at L45 and as well at L34. Adjacent segment disease is due to 1, the normal age-related arthritic process, as well as increased stress at the level above or below a prior fusion. The onset of symptoms from adjacent segment conditions in this case was aggravated by the work exposure. His lumbar treatment needed flowed from the work exposure. Our treatment plan was a decompression of the affected levels and an extension of the fusion. In this case, this gentleman was scheduled for an anterior delayed staged posterior surgery, L3 to S1, which would also require hardware removal at L5S1 for the posterior surgery. The surgical plan was unfortunately changed. After the anterior surgery, he had very labile blood glucose levels. His elevated blood glucose levels were felt to be a contraindication to perform the posterior surgery during the same hospitalization. Under normal circumstances, I like to do both the anterior surgery followed by the posterior surgery, and doing those two procedures on separate days offers a shorter surgical time and a lower rate of intraoperative complications. In this particular circumstance, however, after the anterior surgery, we could not safely proceed with the posterior surgery. Because of his uncontrolled diabetes, he had an increased risk of cardiac complications, deep venous thrombus, surgical site infections, and postoperative shock. So we delayed the posterior surgery for 1 month to get his blood glucose levels in better control. Unfortunately, during the delay in performing the posterior surgery, he did have some subsidence or collapse of the cage into the L45 disc space. This subsidence resulted in a loss of disc height. This is something that can occur with anterior surgery. His posterior surgery was delayed for approximately a month. This gave his medical doctors adequate time to optimize his medical condition and get his blood glucose back under control. We know that diabetes, especially poorly controlled diabetes, is associated with worse patient outcomes and increased risk of complications. After undergoing the posterior fusion, this individual had a significant improvement in the Oswestry Disability Index score with 32-point improvement. His back pain and leg symptoms in his lower extremities were significantly improved, and his hemoglobin A1C, which is a measure of blood glucose control, has been much improved since his final surgery. Thank you very much for listening to this case presentation. In my practice over the past 20+ years, I've realized that patients respond differently to the stress of surgery. It's important for a healthcare team to be compassionate and competent and tailor their treatment to the patient's specific needs. If you have any additional questions about our care of patients with complex spine problems or interest in expert witness work, please contact my office. Thank you.